Hi, everybody. My name's Dr. Monica Rivera-Mint, and I'm a board-certified neuropsychologist, which means that I'm interested in the relationship between the brain and behavior, and I focus on working with people from minoritized, underrepresented populations as they age. I'm particularly interested in brain health and mental health, and that's what we're going to be talking about today. Okay? Okay, so here you see a little bit of information about our study, our website. My pronouns are she, her, and Aya, and I am a professor at Fordham University and at Mount Sinai, and I'm really happy to be here. So today we're going to be talking about a couple of different things. First, we're going to be talking about positive aspects of aging, because so often we hear about all the negative aspects, but we try to keep things positive and not always just focus on the negative. So we're going to be talking about positive aspects of aging, four aspects of brain health that are related to aging, and then things that we can do to age in a more healthy way in terms of our brain health to reduce our risk of Alzheimer's. And then we're going to talk about something called SMART goals, which maybe you're aware of, maybe you're not, and a little bit about our research. Sound good? Okay, great. So first, I want to highlight that there are many different aspects of diversity. So oftentimes you might think about gender diversity or race ethnicity, but age is also a dimension of diversity that's really important as we think about working with different people across the lifespan. And certainly, we, in our work confront ageism, and not infrequently, unfortunately. And basically what that means is the discrimination of older individuals because of their age. And this is based on negative and inaccurate stereotypes. And even though we know that age is associated with increased risk for different chronic conditions and even dementia, there are also many diverse ways of getting older and positive benefits to aging that we want to highlight. So we're going to do a myth and mythbusters approach. So myth number one, people get less creative with age. Not necessarily. In fact, research shows that among many different kinds of people, including artists and musicians, they get more creative in their later years. And you just have to look at Bob Dylan or, the Rolling Stones and, even Pablo Picasso to think about a couple. Next, there's this myth, it's a story, that cognition always invariably overall gets worse with age. However, it's a more mixed picture than that. So some aspects of our thinking abilities do maybe get slower as we get older. So our reaction time might get slower. However, other aspects of our thinking abilities, like our ability to have good attention and focus, can actually get better over the years. And this third one drives me nuts. Aging is burdensome for society. Actually, older adults in our culture provide important support in the workforce, in terms of volunteering and community organizations, and also caregiving. How many individuals have had the benefit of having grandparents, uncles, aunts providing childcare? I'm definitely a very grateful recipient of that kind of caregiving from my own parents and over the years, and have been very grateful for that. And caring for one another. Thank you very much. That's such a good point, Joseph. And not only that, but older adults tend to have more social maturity. And in this one really interesting study that was published, they found that compared to younger adults, older adults seem to be more agreeable and even honorable, better at regulating their emotions. They tended to get along better with others. They paid better attention to their health, and they tended to take less risks in order to take care of their health. So we highlight all of this because there's so many important positive aspects of aging. And this might seem like a little bit of a busy graph, I know, but listen first to my words. So what's really interesting is that even despite some of the potential challenges that people might experience with getting older, so maybe they might be slower, or maybe they might have a chronic condition, despite that, overall, older adults report greater happiness and life satisfaction compared to younger adults. So let me repeat that. Older adults report greater happiness and life satisfaction compared to younger adults. And researchers call this the paradox of aging. And what that means essentially is that what research suggests, if you look at this graph on the bottom line here, I don't know if our Zoom folks can see this, but the bottom line called the x-axis has your age. So from 18 all the way up to 80. And up on the left side, the vertical bar is the score on this life satisfaction and happiness measure. And what we see is that individuals, when they're younger, they tend to be pretty happy. But then as the years go on and through middle age, that level of happiness and life satisfaction goes down. But as we get older, it comes back up. So even despite some of the challenges of life, we overall can see this U-shaped curve in happiness.
It makes sense.
This really makes sense. It might initially be counterintuitive, but it really makes sense because in early life, in early adulthood, folks might be going to school, but they don't have a lot of kind of heavier obligations or responsibilities. But then as we move into middle age, there's, work, being a caregiver for children or for adults, so there are many more obligations, I think is how Marcy talked about it. But then as we get older into, certainly into our 60s and on, things change. And with that change, there could be an easing, assuming that we're in good enough health, an easing of those obligations and burdens. And also, and I think that's right. And on top of that, research also shows that as individuals get older, sometimes the hits do keep coming and people might confront chronic, conditions and the loss of friends or partners. But even when those types of stressors come up, older adults tend to respond to them better because they become more wise, right? They have better emotion regulation. They've been around the block before and they don't tend to get as waylaid and kind of thrown to the side as, say, individuals when they're younger in life do. So this is all to really highlight, many of the positive effects of aging. And thanks for that, Marcy. So are there any other positive aspects of aging that you've experienced that maybe we haven't talked about or that you have observed? There are perks to getting older in terms of benefits for medical care, benefits for public transportation, for recreational opportunities, and we love all of that. So that certainly could contribute to better, kind of better life satisfaction. I love that, Nancy. So I don't know if folks were able to hear what Nancy said, but it was such a great comment about, in addition, we value our social relationships more, maybe because of the losses we have over the way, but we can recognize people for their characteristics as they are and appreciate them in ways that maybe we don't when we're younger and maybe more frazzled. Yeah, and accept, yeah. And this whole idea of acceptance, I think, is a big piece of what we're talking about in terms of life. Right. And so Marcy's talking about how important it is to have that perspective, right? A different lens as we age that lends us a greater understanding of what really matters, what's important to our values, and how the smaller stuff really is smaller stuff when it comes to really thinking about the bigger picture. So that is great. Thank you for that, everybody. So let's talk about some aspects of brain health as we age that we're going to be talking about today. So here we've listed out 4 different aspects. So cognitive health has to do with our thinking abilities, so how well we think, learn, and remember. Our mental health or emotional function has to do with how well an individual interprets and responds to emotions. And there are 2 other aspects here: motor function, how well we can make and control our movements, and tactile function, like how well we can sense things. Here today, we're going to focus more on the first 2, and most of the rest of our talk is going to focus probably on the first one. But before we do that, we just want to touch on mental health, to talk about depression, because just want to highlight, especially as we move into the holidays, that sometimes this is something that individuals struggle with. And depression is a serious mood disorder. It can affect the way that we think, feel, and act. And while it can be common among older adults, I want it to be really clear in the top right box that clinical depression is not a normal part of aging. It's not a normal part of aging, and we have to attend to the people we live with, to our clients, our patients, to make sure that if they are demonstrating symptoms of depression, that we're attending to that. And also, just to highlight, just because in our work we focus on diverse populations. If you look at the bottom right box here, it's also important to note that depression can manifest in many different ways. It's not always just like a blue mood or, kind of the hallmark signs of sadness. Sometimes it can manifest, especially in diverse populations, particularly Latinx or Hispanic and Asian diaspora cultures. It can manifest in an individual's body. They might have complaints about feeling nervous or having aches, pains, headaches, and those kinds of things might also be clues that we can attend to in ourselves and in those we live with and work with.
I think also just to comment, I don't know if I'm enunciating well enough for people on Zoom to hear, but I think also, at least in my experience, in many immigrant communities, they also lack the language to describe it.
Right.
So I know in my own grandmother, she doesn't know the word
Right.
to even explain depression or anxiety. So she just calls it nervousness.
Right, exactly.
But I know that's what she means. So I think that also is something to consider. Also, just the challenges people have when they're in another country, just being able to describe these kinds of things as well.
So for those folks who weren't able to hear Joseph and Marcy, they were making great points about not only is it that depression can manifest in different ways in people from different cultures, but also that individuals from different cultures might not even have the words for it, right, and understand necessarily what it is, and that this idea of going to therapy, to a therapist outside of the home, isn't necessarily one that everybody has, and thinking about other more flexible ways to make sure people can get connected and get care is really important. And another important point before we move on as we think about depression is, while depression might not necessarily be preventable per se, a healthy lifestyle can really have significant benefits for mental health and really kind of mitigating risk for future depressive episodes. And all the things that we're going to talk about for the rest of this this talk that pertain to either brain health or like your health for your thinking abilities, all of those things also help reduce the risk of improve mental health and reduce your risk for future episodes of significant depression. So let's talk about 7 healthy behaviors that could reduce Alzheimer's or dementia risk. And again, we highlight Alzheimer's here because Alzheimer's is the most common type of dementia. And again, for folks, if you're not 100% clear, dementia really just has to refers to a neurological change, brain changes that people weren't born with, but that once they've reached a certain age, they might be experiencing different brain changes that can cause declines in their thinking abilities and their everyday functional abilities. But what we know is that making small changes to your to how you live your day-to-day life can really improve your brain health and your thinking abilities. So the first thing, so number 1, take care of your physical health. So we have a whole list of ways that you can do that here, and we're going to share these slides as a PDF. So I'm not going to necessarily read every point by point, but it's really important. Just the big takeaway from this kind of busy slide is make sure to take care of your overall physical health. Things like getting, recommended health screenings, reducing your risk for falls or accidents, making sure to get enough sleep, and avoiding alcohol, drugs, and smoking. These are all things that can really help us maintain our brain health and our thinking abilities as we age. Number 2, very specifically, I am going to highlight this, which is to manage high blood pressure. I want you to, like everybody, take your right hand and put it on your heart, and then take your left hand and put it to your brain, and imagine a little train going from your heart to your brain. That's your heart-brain train. And we want to make sure that we are doing things that are healthy for our heart because it helps the heart-brain train, right? What's good for the heart is good for the brain. And so preventing or controlling high blood pressure really helps your brain health. And this is particularly important in midlife because high blood pressure in midlife can actually increase your risk for future cognitive decline as we get older. But at any age, lowering your blood pressure and maintaining that blood pressure can really help. And we also list some other things that you can do here for that as well, like exercise, diet, and medications. And we're going to talk more specifically about that as we move forward. So there's been so much research done to try to find drugs and different types of treatments for Alzheimer's and different types of dementia. But it turns out that one of the best, most important things that an individual can do that is scientifically validated to help their brain health and reduce the risk of Alzheimer's and other dementias is to eat healthy food. It's the data, the effect sizes are so remarkable, but eating a healthy diet really reduces your risk for many chronic diseases, including dementia. And here in this wheel, we list out all the different things that you can do. And more specifically, what studies have shown is that something called the MIND diet, or sometimes a variation on that, the DASH diet, that these diets can really have a significant role in lowering the risk for Alzheimer's and lowering risk for cognitive decline. But the MIND diet is basically like a Mediterranean diet. So lots of fish and whole grains, fruits and vegetables, olive oil, and really avoiding red meat and highly processed foods. So really think about whole foods, things that are just have one ingredient in them, like an apple is just an apple, or a piece of celery is just a celery. And this is really profound, and this is something that we can actively affect in our daily life. So here also an important reminder for folks that eating a healthy diet doesn't have to be you on your own, but we can also think about eating more healthily in community settings, in our work settings, because food is love, right? And if we can really promote that within ourselves and within our loved ones and friend groups or work groups and communities, it can be transformational to improve brain health. Number 4, be physically active. The research also suggests that this is a really big factor in maintaining your brain health as you age and reducing your risk for Alzheimer's. And so what the research shows is that a regular exercise program, which could be things like, the household chores, going on errands, going for a brisk walk around the neighborhood, dancing, or, for our Latinx individuals on Zoomland, if there are any, and just people who love Latin music, salsa dancing, right? That's a great way to get a wonderful workout. And the key thing is anything that gets your heart pumping. The research shows that if you do, about 2.5 hours or more of more kind of heart pumping physical activity every week, that has a significant improvement in your brain health. So that's like what? Not even a half hour every day, right? And so if we can think about, walking, if we're able to walk, or even if you're seated, doing exercises, that can all help. And in terms of the how, the research shows that aerobic exercises, again, things that get our heart pumping, tend to be the best for cognitive health. But before you do anything, if it's a new activity program, make sure to check with your physician or healthcare provider to make sure you're safe to start an exercise program. And here we have many different, hopefully inspiring pictures of things that you can do to exercise and get your body moving. In fact, I came here today on my bicycle, which was really fun. And I realized that I neglected to introduce my 2 colleagues who joined us here from Sinai as well. So I really apologize for that. Yeah, so that's Alicia and Kamui, and we also have Chanel Ramirez, and they are our community research liaisons. So they work with community organizations like yours and many others, and they're going to lead us in a 1-minute seated stretch activity to help get our blood moving and our bodies moving. Okay. Yep.
Hello. All right. So it would be great if everyone could sit down with both feet on the floor. And we're going to start with 2 deep breaths. So inhale, exhale. Inhale, exhale. All right. So now we're going to take one of our hands, bring it over to the side. If you don't have an armrest, you can put it on your thigh. A little twist. Turn to the side, look behind you. And then repeat on the other side. Lengthen your neck, keep your shoulders down. Fantastic. And I'm using my previous experience as a Zumba instructor today. And now we're gonna do a crescent stretch. So bring your hand up over your side, reach high, turn into a crescent moon, look up, try to keep your palm open. Take a deep inhale, exhale, and switch sides. Look up towards that beautiful moon. Really feel that stretch in your neck and your shoulder. Fantastic. And now we're gonna do a shoulder stretch. So you're going to go across, try to pull down so you can feel it right here.
Oh, I feel it.
Yeah.
Oh, can
Another-
you describe it for the telephone participants?
Oh yeah. So you are reaching across. You're gonna grab your elbow. Your one of your arms is gonna make an L shape above your head, and then we're gonna switch sides. So your other hand is grabbing your other elbow. You're pulling on the elbow, bringing it towards the side of the body, the other side of the body. Take another inhale. Exhale. And then, if you're able to move your legs, if you could grab one foot, put it on top of your knee. We're gonna make sort of a number 4 with our legs. And you can push down on your right knee. Feels so good in the hip region. This is great. Another inhale and exhale. And now we're gonna do our last one, switch sides. Make sure you're sitting up straight. You can push down below the knee, not on the knee, so you don't put that pressure on your joint. And one last intentional inhale and exhale. All right, that's our stretch.
Woo. Very nice. Thanks. Yes. So thank you so much for that stretch break. So, okay, and as a reminder, again, we're talking about 7 different behaviors that we can engage in to reduce our risk for Alzheimer's, dementia, maintain our brain health. And now we're on number 5. So number 5 is about keeping your mind active. So it turns out that engaging in personally meaningful activities can actually make you feel not just happier and healthier, but learning new skills using your thinking abilities, your memory, can actually improve your brain health. It can reduce your risk for Alzheimer's. And there are many benefits to engaging in different ways of keeping your mind active, including increased quality of life across many different spheres. Feel better. It can increase your social interaction if that's the way that you move forward. It can reduce stress, improve your self-esteem, and studies show that there can be significant benefits to your thinking abilities, including your memory. Yeah, absolutely. So I don't know if folks heard Marcy, but she gave us 2 great examples of folks who've kept their minds active as they have aged, who recently passed, including Justice Sandra Day O'Connor from the Supreme Court and Henry Kissinger. And there are so many other examples, but this really gets to the idea of neuroplasticity, right? And you know, if you've heard this phrase, use it or you'll lose it, right? So the more we use our minds, the more active we keep them. That means that we're creating new connections in our brains and keeping those neurons firing. And this is protective for our brain. So potential activities might include reading books. In fact, there's some research also that shows very particularly novels. Reading novels seems to be good for your brain. Play games, teach or take a class, learn a new skill or hobby, work as a volunteer here at Search and Care or other places. All of these things can have a profound impact on keeping your mind active and helping you with your brain health. We do have a warning here in red though. Research in terms of computer or online training, like brain training apps, there's not enough evidence really for those for us to know if those actually help or not. So like, I don't think that they would hurt per se, but we're not necessarily espousing that. Okay.
You have some challenges.
Oh, here, thank you. Let's see what people are saying in the chat. Marcy, could you speak up? Also, we have more time to learn things as we have more free time in terms of aging. That's right. So that's actually right on point with what we're talking about. You have more time to use your mind in new and creative ways, which is really wonderful. Now, number 6 is staying connected with social activities. So this, I think all of us felt this during the pandemic, how important it is to stay connected and engage in social activities. And what the research has shown is that connecting with other people can help you feel more engaged with your environment, can lower your risk of general health problems, boost your mood, and it appears that engaging in more social activities also helps reduce your risk of dementia. So we are social animals. We came at, from a pack, from a kind of a pack mentality eons ago, and staying connected socially is very important for us at, throughout our lives, especially as we age. So here we have a whole list of different things on Zoom that you can do, like volunteering, joining a group, doing a walking group, engaging in programs at local organizations like Search and Care or the Alzheimer's Association, so many others. And if you can't get out of the house, there are so many opportunities now, thanks to the pandemic, for online connection, right? So we can connect by phone or the internet as well, as so many of you are today. So let's stay socially connected. And 7th, and finally, managing stress. So stress is a part of life. So if we're alive, we're going to experience different kinds of stress. But long-term chronic stress can negatively affect our brain health and our bodies and increase our risk for Alzheimer's. So it's really important that we learn functional ways, healthy, positive ways to cope with stress, and things like exercising regularly, engaging in relaxation techniques, stretching, writing in a journal, really keeping an eye on your own mind and how you're reacting to the stress, which is really hard to do. But things also like meditation, even if it's for a couple minutes a day, can help us stay positive and stay engaged. We already talked about depression and mental health, so we're going to go down to SMART goals. So let me see how we're doing on time. So it's 12:36. We want to keep time for questions, but we're in now the home stretch of our time with you. So I think we have time to brainstorm a little bit. So we'd like to. I'm going to take it over to Chanel and Alicia to talk about maybe how we can brainstorm and set goals for healthy brain behavior. So who wants to talk about this? Yeah, you want to get closer?
Yeah, maybe you should sit there.
Yeah.
Hello. So we want to work together on SMART goals. So what exactly is a SMART goal? These are ways that we can think about our habits and our routine to get us to that goal. So SMART is an acronym. S is specific. So we want to be very specific about what it is that we want to accomplish. M is for measurable. So you want to use mini goals that help us to not only get to where we want to be, but also kind of help to measure our progress as we work towards that. Achievable, we want to make sure that our goal is reasonable, right? You're not going to go from somebody who's never, ran for 10 minutes to suddenly signing up for the New York City Marathon. So you want it to be things that these little wins that get us to that big win. Realistic, again, a goal that is relevant to your life so that it makes sense to you personally. And timely, you want to give yourself that timeline, you want to give yourself that deadline, so that it's not something that's just off in the distance in your head. So together we're going to create our SMART goals for us on healthy aging. And our next slide here is going to remind us of the 7 healthy behaviors for better brain health. So let's start to really think about what some of our SMART goals that we can practice to take better care of your physical health or to better manage your high blood pressure. What's a SMART goal for eating more healthy, delicious foods, being more active, a SMART goal for your mind, a SMART goal of how you can stay connected or manage stress. So we're gonna do this together here. And for our Zoom folks, Alicia is gonna pull up our Jamboard. And for us here, we're going to work on this together. I have some fabulous colorful Post-its.
So again, we're writing what our SMART goals for healthy brain aging are. So if anybody has a particular goal. Oh, I just wanted to make a comment. One thing that we always like to share with people at Search and Care is, when you're making goals and things, especially if you're struggling with memory issues, is to try to make a routine, right? Because I think routine is how you're going to help yourself stay on top of those goals, right? So one of my clients who's really struggling with memory issues, I advised her, every time you have breakfast, do this. Every time you have dinner or you clean up after dinner, do this, right? So then it becomes something that is part of your routine and you have some kind of point throughout your day that'll help jog your memory, right? So the breakfast, I'm going to do a crossword puzzle after breakfast every day, or after dinner every day, I'm going to take a walk, right? So I think using something in your day to help you stay on your goals is a good tool.
That's great. Did everybody hear Chanel's term habit stacking? So when we pull together different things to make a habit, that's really smart.
We have one from Zoom. I would like to drink more water.
Oh, great, that's a good one.
Staying hydrated is so important. I know, for example, my grandmother, she doesn't like to drink water because she doesn't want to go to the bathroom too frequently. And that can be, a challenge as we get older, but it's super important to still keep drinking water. Make sure that you keep yourself healthy. It affects your energy levels. We want to make sure that we're staying out of any emergency situations where people don't have enough water. We're mostly water.
So when we think about this goal of wanting to drink more water, we tie it back to a SMART goal. So let's be specific and let's set a time. When I wake up, I'll have a glass of water. And then you'll already be home. So if you do need to use your restroom, you'll have access to that really.
Marcy was saying if you wake up in the middle of the night, you could also drink water then.
Yeah, Marcy, you might want to come up here when you
I know.
so people can see you or hear you better.
Yeah.
Yeah, I know some people are worried about falls during the night.
Right.
That's probably another thing, but also, I think it's a part of it, right? Healthy brain aging also has to do with home safety, right? So one may
Avoiding
want
risks
to,
and falls.
right?
Yeah.
So one may want to consider having battery-powered night lights, right? In case the power goes out, you have access to night lights. One might also want to consider getting a commode, so that way, if they need to use the restroom, it'll be closer to where they're sleeping.
Great job. Thank you, Alicia and Chanel, and everybody for participating. And for the last component, just to wrap up our time together, we wanted to talk a little bit about research. So I'm a neuroscientist and a community-based researcher. And as I mentioned, I'm interested in brain behavior relationships. And we have many studies here in Harlem and across the country dedicated to understanding brain health and dementia, especially in diverse populations. One is called the Study of Aging in African Americans and Latinos for Understanding Dementia. And for our next iteration of this study, we hope to expand to other populations as well. But just to give you an idea about what we're talking about when we talk about research, a research study is when a scientist tries to answer a question about something that we don't know about in a systematic way. And in Salute, our scientific questions relate to trying to understand how a person's cultural background, so their values, language, and aging both affect our brain and thinking abilities as we age. That's our first question. And our second question that we're interested in is trying to understand how culture and aging affect older adults with and without HIV. And why we think this is important is because that compared to non-Latinx white older adults, Latinos and African American adults are more likely to experience more mental health conditions or concerns and be diagnosed with dementia in their lifetime at a higher rate. Yet these populations are less likely to access mental health care and to be engaged in research. And if folks aren't getting involved in research, they can't inform the treatments that can help them, right? So it's really important to think about how one of the ways that we can contribute to our communities and to our children, our grandchildren, and to our broader society is by participating in research. So our work is really focused on increasing representation of diverse individuals into research. And so if anybody's interested, we're providing our a website where you can follow up, and also for those who have a phone handy, they could take a picture or they could put their phones against that QR code to go to our website as well. And there's another study that we're involved in that's focused on older adults called the Alzheimer's Disease Neuroimaging Initiative. And this study, it's called ADNI, has been around for over 20 years and focuses on understanding the progression of Alzheimer's using biomarkers, which are things like tests of thinking abilities, MRI or neuroimaging, so tests of your brain function, blood tests, many different types of things. And in this study, individuals who are 55 and older can participate. And the data from this study helps us understand which biomarkers are the best for helping us diagnose dementia. And this study in particular has provided the methods and the infrastructure for all of the new and exciting medications for Alzheimer's that have now more recently come to be available, like lecanemab. So, and here we have another website where if you click on it or you go to it, you'll be able to see what it's like to be a research participant with the principal investigator. So now we still have a couple minutes left, which we wanted to make sure we had at the end. So if there are any questions about anything that we've talked about, or things that maybe we missed, this is a great time to do that. And also you have my name here, our email, and our phone number. And I think that's about it. Yeah. So
Something in the chat.
oh, thank you. Okay, let's see what's in the chat. This has been wonderfully clear throughout and reassuring presentation. Oh, thanks, Orla. I appreciate that. We appreciate that. And I also want to give gratitude and thanks to Chanel and Alicia for working so hard to put this beautiful presentation together for all of us today. So I'm going to take these slides down so we can chat, but I just want you to all remember that we wish you happiness and salud, which means health in Spanish, and very happy holidays as we move forward.